we always have to be a little bit careful, right? It is the middle of an outbreak, and there's a lot of factors that can kind of influence the numbers we're seeing. But certainly we have seen a slowdown in the number of cases that are being reported in a lot of European countries. For the moment, even though there are some countries that have been rolling out the vaccine, we are also seeing a slowdown in some countries that haven't had access to a lot of vaccines here. So there's a good case to be made that at the moment, this is probably due to behavior change. So we know that this virus is mostly spreading in this group of men who have sex with men. And, in general, there's some data also anecdotally myself, I am a gay man. And if I talk to friends, I can see that people have really changed their behavior for the moment. So it looks like the numbers are going down. But of course, as the threat recedes a little bit, there is a danger that behavior then changes again, and we're not going to be able to keep up a behavior change in the long run. So it is very important to see what happens in the next few weeks and months.
And the slowing down in numbers, is this pattern being seen in other parts of the world as well?
It depends a little bit on where you look. So at the moment, we're still seeing fairly steep increases in numbers in parts of Latin America, for instance. There's a few countries that are, that are a little bit behind, I would say, on the epidemic curve. So we're seeing the kind of rise in cases that we saw in Europe a few weeks ago in places like Brazil and Argentina and other places there. There's every possibility that this plays out differently in different parts of the world. It has a lot to do with, the information that people are getting, how well they are equipped and how empowered they are to take care of their own health. It has a lot to do with places where maybe gay sex is criminalized and it's much, much harder for people to access healthcare and to access good information. So this could play out differently in different parts in the world.
The WHO says it is possible to eliminate the monkeypox outbreak in Europe. How so, and in what kind of time frame?
So, first of all, it's maybe good to just emphasize that, of course, it is sensible in a situation like this to try and completely get rid of this virus again. What the WHO Europe really means when it says let's eliminate this virus, it means going back to the situation that we were in Europe before May. So essentially, there might be occasional cases that are imported, but there's no sustained human-to-human transmission in Europe. Because we don't, at the moment at least, have an animal reservoir, so we don't know of any animal species in Europe that carry this virus all the time, it is possible in general to try and get rid of this virus in this way. But it could take a long time, especially if the behavior changes again. We might see an uptick in cases again. But this is the goal, and I think it makes a lot of sense to try and go for this.
And this could possibly be achieved despite limited vaccine supplies?
So this is one of the big questions, I think. Certainly the vaccine supply is an issue. It is an issue that's also a question of global inequity. We have seen the vaccine go mostly to a few rich Western countries. We have countries in the world that have dealt with monkeypox for many decades that don't have any access. So we need to see, there are ways of dealing with this beyond the vaccine, of course. Getting people to be diagnosed much earlier, getting people the information to know when they have the symptoms that might be monkeypox, and then making sure that they don't expose other people. These are all ways of reducing the spread of this virus. Remember that this is a virus that doesn't spread that well from human to human. And we are seeing it at the moment spreading in one particular group and mostly through, as far as we can tell, sexual contacts. And so we do have an opportunity to very specifically, target where this virus is spreading at the moment. But in the long run, I do think we will need a vaccination campaign in the most at-risk groups. And that will probably include getting more data on whether we can split the doses for the vaccine, for instance. This is being done in some countries. And we have to get some good data on how protective, a fifth of a dose of this vaccine is, for instance.
Which countries are experts most concerned about right now when it comes to monkeypox?
I think it's very hard to tell. Personally, I'm most worried about the countries where we have the least data, in a sense. This virus has spread to more than 100 countries. It is a safe assumption, I think, that it has made its way practically everywhere. And so countries where gay men have very little access to healthcare, where maybe there's no surveillance, are the ones that I'd be most worried about. The European region of the WHO has been very clear that one prerequisite for eliminating this virus is to have a really good surveillance system so that you can actually detect any cases that come up. That's the only way that you can be sure that you're actually eliminating this virus. So I think the first step everywhere in the world is to make sure that everywhere in the world has the capacity to detect this virus early on, and it gives people an opportunity, if they might have been exposed to this virus, to get tested. So it's not just access to the vaccine that needs to be, distributed globally, it's also access to the capacity to be tested for this virus and get a diagnosis.
Just finally, are you hopeful that it will be possible to eliminate outbreaks of the virus globally?
I'm really torn. I think it is very possible that Europe, for instance, can do this well. But I think there's a huge danger that we fall back into this kind of, cycle of panic and neglect. As this recedes a little bit in terms of the threat, it's very possible that that there isn't the continued push to really eliminate it that we would need. And then, like I said, there are some countries in the world where it's just much, much harder to even get to the point where that push is something that is politically motivated. So I refuse to be, to give up. I think we have a real possibility with this virus. We should be able to eliminate this virus. And it would be an indictment, to be honest, of where we are in public health in the year 2022 if we don't manage to do this.
Kai Kupferschmidt, I think a lot of people share your thoughts on that. Thanks so much for your time.
Thank you.